Hello guys, welcome to my YouTube channel. I'm glad you're still here to listen to whatever I have to say. I think that's a good sign that I'm doing something right. So thank you for the encouragement. I'm happy to help as much as I can. As I mentioned in my previous video, we'll be going over how to make use of the good medical practice guidelines to approach the professional dilemma questions in the MSRA exam. So in this video, we'll go over a couple of sample questions from the official MSRA website. And the aim of this video is basically to learn how to categorize the questions based on the different domains that the good medical practice guidelines cover. When we're able to identify these different things or principles or domains, it makes the job of answering the question based on these guidelines easier. So we'll be going over that in a few minutes. Before we go ahead, please like this video. If you haven't subscribed yet, please click the subscribe button. And if at any point you've got any questions, don't forget to drop them in the comment section. So yeah, let's get straight into it. So what are the common themes that are covered by the good medical practice guidelines and by extension by the professional dilemmas section of the MSRA exam? Number one, patient safety or patient focus. Coping with pressure, professional integrity. Number four, working with your team members, communication, empathy and sensitivity. Number seven, have I mentioned coping with pressure? I have, okay. Commitment to professionalism. Okay, what we're going to do is I'll read out a scenario, then I'll give you a few seconds to think about what domains you think are being explored in the particular scenario. Then we'll take it from there. So, to our first scenario, you're looking after Mrs. Sandra Jones, who is being investigated in hospital. You are asked by her family not to inform Mrs. Jones if the results confirm cancer. Choose the three most appropriate actions to take in this situation. So what do you think is being explored here? What domain? Okay, so if you said patient autonomy and confidentiality, you're most likely right. So the different options are listed here. What do you think the answer might be? So C, D, E will be the appropriate answers. Why C appropriate? Because you already have at the back of your mind, you already know that this scenario is assessing patient autonomy. So of course you want to explain to the family that it is her decision to make. So why is D also appropriate? You're also recognizing patient autonomy. So you want to find out, first of all, if she wants to know the results of her test. So E, ask Mrs. Jones whether she wishes to inform the family. Also, patient autonomy, and this is where confidentiality comes in. So you want to find out from her first if she wants the result to be disclosed to her family. The other options are obviously wrong. You can't just ignore the family's wishes. That you're not solving any problem by doing that. Agree not to tell Mrs. Jones. Yeah, withholding information from her. So that breaches the rules on openness and honesty as a medical professional. F, inform Mrs. Jones that her family do not wish her to have the results. That also breaches the rule about openness and honesty. Give the result to the family first. Confidentiality is being breached. Give the result to the next of kin first. Confidentiality is being breached here. So it's very easy. Once you understand the different guiding principles, you're able to really weed out the rubbish answers and then just hone in on what you think is most appropriate and then select from those options. Next scenario, you feel very upset after a performance assessment with your clinical supervisor on the ward. You feel that your supervisor was rude and undermined you in front of the patient. Choose the three most appropriate actions to take in this situation. So take a few seconds and try and find out what particular domain is being assessed here. So working with colleagues as well as effective communication. All right, so A, speak to your clinical supervisor about how you feel. Communication, openness. Apologize to the patient for the behavior of your supervisor. Usually when you are not the one at fault, yeah, you shouldn't own up to problems that you did not cause. So I would rank that lower. Wait until you're calmer to take any action. That does sound like a reasonable answer. So I'll put it at the top, but I will not answer it just yet, in case I find something that's more appropriate. Speak to your program director as soon as possible. That's a bit hasty. So you should never take any decision in haste, especially if it does not affect patient safety. Reflect on whether you can learn from the feedback. That sounds very reasonable. Anything that contributes to your professional development and commitment to professionalism. Discuss your supervisor's behavior with your colleagues. That's not a sign of a good team player, because that's gossip basically, and that contradicts the principles of teamwork. Behave normally so that your supervisor does not realize that you are upset. So there's no openness in that. There's no honesty and integrity in that. So of course, you would not rank that as a good option. So we've got our answers. Speak to your clinical supervisor about how you feel. Wait until you're calmer to take any action. Then reflect on whether you can learn from the feedback. So all of these three, when combined together, will help to make the situation better. Our next scenario, you're a foundation year 2 doctor working in the emergency department. A colleague who's also an F2, Sarah, asked you to assess a patient for her. The patient intoxicated with alcohol and was verbally abusive to Sarah when she attempted to assess him. Sarah is very upset about the incident. What do you think is being assessed here? Empathy and sensitivity? Yes, correct. So you want to consider that as your rank. So the option A suggests that Sarah sees the patient herself. That's obviously very callous, very insensitive. So I'll move that to the bottom. Suggest that Sarah takes a break. That makes sense. I'll leave that as it is. Allow Sarah to tell you how she feels about what happened. That sounds very reasonable. So I'll take that up. Inform the ED consultant about the incident. That is a good suggestion. However, I can't see how it's going to resolve the problem at hand, which is Sarah's current emotional state. Assess the patient for Sarah. Also very good, but it's not helping Sarah in any way. So how do we rank these? Like I said, allow Sarah to tell you how she feels about what happened should come first. Why? Because you're recognizing her current emotional state, you're being empathetic and sensitive towards your colleague. Next, suggest that Sarah takes a break. This is also helpful because you're also taking into consideration her feelings. However, you're just suggesting she takes a break. You're not really trying to find out how she's feeling and trying to offer any kind of support. So that will rank second. The next answer ought to be assess the patient for Sarah. So this is good, but it's not so good. It's not so appropriate because even though you're attending to the patient, Sarah's current state has not been addressed. So that's why it's like the third option. It's better than inform the consultant about the incident. Why are you telling the consultants at this point in time? Sarah, you've not addressed Sarah's current situation, how she's feeling. The patient has not been attended to. So that should come after as your fourth option. And the final option should be to suggest that Sarah sees the patient herself, which we mentioned earlier is very insensitive and definitely contravenes what the GMT, Good Medical Practice Guidelines, talks about with regards to empathy and sensitivity. I hope you can see now how understanding the domain being assessed by a scenario can help you streamline the thought process involved in ranking your answers or selecting the most appropriate options. Okay, so our next scenario, you are an F2 working in respiratory medicine. Alan is also an F2 working in the same ward as you. You see him when you are not at work, and he tells you that he will refuse to have the seasonal flu vaccine. What do you think this has to do with? Out of all the domains, professional integrity. So you've got your options, and we're just going to rearrange them. So ask Alan why he's refusing to have an influenza vaccination. That sounds very good because you're first of all exploring his reasons. He might have an allergy. He might have had a negative experience with it. You can't tell. So you want to assess and explore his reasons before you proceed to know what to do next. So that should come first. Most of the time, exploring the reasons for a patient's refusal of treatment or investigation or a colleague's refusal to undergo something that's required of the GMC, you shouldn't just rush into insisting. You should always explore before knowing the next step to take, just to have a better understanding. Okay, so inform Alan about the risk to patients. That sounds like a very good idea. Tell Alan he should get an influenza vaccination. I will take that to the bottom because, like I said, always explore. Don't be in a haste to insist. Every human being has the right to decide what they want, as long as it's not compromising patient safety and it's not a criminal decision that they're making. So you want to explore, you want to give information about the risk. Maybe he didn't know or he hasn't really considered the risk to patients. So you want to inform him. So tell Alan it is not fair on his F2 colleagues if he gets influenza and they have to cover his work due to illness. This sounds like a good way to reason things out with him. However, it is a very selfish way to reason it out. So I will rank that just before insisting on him getting the vaccine. So that would be like the fourth position. So tell Alan the GMC says he should be vaccinated against common serious communicable diseases. So they're just giving him information, which he probably already knows and he must have considered. So I wouldn't put that at my top 2. So that will come like my third position, right? Okay. So yeah, that's how to address a scenario like this. I hope from these scenarios we've done, you've been able to see how, once again, understanding the domains being assessed will really, really help you to know how best to rank your options and select the appropriate answers. Our last example for this video, you overhear a medical student at the bus stop who's given a horrible description of your consultant's clinical competence. You do not believe that it is his intention to be deliberately heard, but it is clear that other passengers are listening. Rank in order the following actions in response to this situation. So let's give it a pause. What do you think is being assessed here? Commitment to professionalism, yes. So the first option, explain that the student might have misunderstood the reason for the consultant's decision. At this point in time, that's not a priority. So we'll take that to the bottom, like to the middle. Do nothing as it is a public place and medical students are not trust employees. Like I mentioned in my previous videos, most of the time, do nothing is usually the least. Not always though. Sometimes it might be something more stupid than do nothing. So, but in this case, let's just put it at the bottom until we see something that is more ridiculous. All right, so the next option, try to catch the medical student another day to explain that his comments were unhelpful. That seems logical. However, it doesn't address the situation on ground. So I'll take that to, I'll let that remain where it is for now. Write a letter to the dean of his medical school. That is that's an exaggerated response, basically. So I'll take that just to the bottom, just before do nothing. Suggest to the students that he exercises caution when talking about colleagues in public. Yes, this is our golden answer. So it should be at the first rank. So it should therefore be E, then A, then C, then D, then B. So suggest to the students, there you're addressing the situation at the moment. However, you're not doing it in an unprofessional way. You're just cautioning the students, right? If they had said yell at the student or do something or speak harshly or whatever to the student, of course, that will not be your first option, even though you are addressing the situation immediately. So the way you should always understand each option in the context. So don't just use blanket reasoning to approach the different options. EA, explain that the student might have misunderstood the reason for the consultant decision. Try to catch the medical student another day to explain that his comments were unhelpful. That does nothing. D, write a letter to the dean. Like I mentioned, that is an exaggerated response. B, do nothing. Of course, do nothing it should always be your list, almost always be your list option. Okay, so all right, I think that brings us to the end of this video. I hope you've been able to gain something from all of this. I really, really would like for more people to truly appreciate what this professional dilemma section is all about and not be worried about it. Just know that you can actually really tackle it confidently and effectively. And it's also important to know that understanding all of these scenarios is going to benefit you not just in the upcoming exams, but in your day-to-day clinical practice. So it's a good thing to learn. It's an important way of thinking and reasoning to imbibe. So I want to thank you for watching up until this point. I hope this video was beneficial to you. Please like this video, subscribe if you haven't, share it with others who you think will benefit from it. And if you've got any questions, any suggestions, please leave them in the comments and I'm happy to address them. Thank you so much. I really appreciate your support and I will see you in my next video. Bye.